Good morning, everybody. Thank you guys so much for joining us to learn some tricks of the trade to sell Medicare Advantage. We are super, super excited about this one. I'm Jennifer Harris.
And I'm Kristin Fancher.
I thought there was some sound going on. It's outside. So we'll get started. Today, our webinar is Beginner's Guide to Selling Medicare Advantage. And truly, Kristin is going to take over a majority of this webinar because she is what I consider our expert in Medicare Advantage.
I love Medicare Advantage.
She is super passionate about it and can teach you guys exactly how to get out there and add this to your briefcase and portfolio. I'll start with just a little bit, and Kristin, you just jump in anytime you're ready. So this is really the basics, and so if you're we hope to make this a little exciting for people that know about Medicare Advantage and know of Medicare Advantage, but we truly wanted to start with the basics for you guys. So Medicare Advantage plans are essentially, essentially managed care Medicare health plans that replace Medicare Part A, hospitalization, and Part B of medical insurance. So that's why you will hear when people buy a Medicare Advantage plan that they go off of original Medicare. So that kind of explains that a little bit.
Yeah, it'll be referenced as Part C. But one thing that's not included here that I felt like was very important, the majority of Medicare Advantage plans also have Part D in them as well. So, and that you'll learn about, if it's an MA only plan, to watch out, to make sure you don't pair it with a standalone PDP plan, but the majority of them will have Part A, Part B, and Part D included.
So licensed health insurance agents can directly sell Medicare Advantage plans to individuals if they have contracts with the companies and offer these plans, and that's where we can come in and help you guys get ready to go and contract it with the carriers that you need. As an agent, you can work independently through an organization or an insurance company to sell Medicare eligible recipients. Take it from here, Kristin.
Okay. So let's talk some statistics. This graph is really great in the fact that it shows, 80% of Medicare Advantage that's sold or that was sold in 2018, you can actually sell. Of course, you can get into the employer and group coverage, but this webinar and these Medicare Advantage plans that we're specifically talking about are for just the general enrollment, individual plans and or special needs or chronic plans. So I asked Adrienne to do some digging on some statistics for me because I think that it really will show you guys what the actual need is. So out of this poll of the let me back up. So for the Medicare eligible recipients, there is still 1 in 5 that are not on any type of plan, not on a Medicare Advantage, not on a Medicare supplement, so are still on original Medicare. So what that actually equates to for you is, for 2016, the statistic was 19%. That's the only thing that we could find actually on paper. But for 2018, I believe that's more like 15%. So there's 15% of beneficiaries out there who are on original Medicare, which means there's no cap if they go into the hospital. It means that there's, unless they have a standalone prescription drug plan, they don't have prescription drug plan benefits. They don't have dental built in. They don't have any additional benefits other than original Medicare, which has no cap. So there's a need for Medicare Advantage. This also shows kind of the average premium. It says for 2018, the average premium was $34. What I want you guys to notice is the majority of the plans that were sold have zero premium. So over half have a zero premium, and that's what you'll hear a lot of. They want that zero premium plan, and that's what they're talking about. You can see as it goes up, the percentage of enrollees goes down. Typically because, when the benefits for Medicare Advantage are really good and competitive, they're really good and competitive, and typically you'll see that at a very low or no premium plan.
So let me ask you, Kristin, on these, the ones that tend to be more than zero premium, the 20 to 49, is it because that Medicare Advantage plan is adding extra benefits or anything like that? Do you see some of them?
Jennifer, that's a really great question. I think that typically, yes, to an effect, like you may see some of those plans have, like, for example, Allwell has a zero premium plan, but then they also have a $17 plan. Well, the $17 plan has extra dental built in, like a $2,000 dental benefit. But when you go above $50, in my opinion, unless it's due to the drug coverage that's built in covering those drugs, there's probably other options out there that may fit them better.
Okay.
This is one of my favorite maps. I found this when I first started looking at Medicare Advantage and kind of where it's good and where it's dominantly sold. This is the new one for 2018. And why I really like this map is when I talk to an agent who's in Florida, I know that, hey, if you're not selling Medicare Advantage, you're missing the boat. Premiums in Medicare supplements in the state of Florida are just astronomical. They're through the roof. So, in the state of Mississippi, it may be a little bit harder to have a sole Medicare Advantage agent. So you need to know, like, hey, if you're in a lower percentage state, having both is going to be the best option, but there's also a huge opportunity for growth. So as we see, in 2020 Plan F going away per se, not being able to be sold to new eligibles, that includes the high deductible Plan F, which I think it needs to be stated. But there's a huge growth because the trend is going towards Medicare Advantage. So if you're in Mississippi, there's a lot of growth and a lot of room for Medicare Advantage health.
And I think the reason that you're seeing a lot of trend towards that Medicare Advantage is, like you said, the Plan F, the change in the Medicare supplements. There probably will be a high deductible Plan G that's introduced. But it all goes back to that cost sharing, where the government is trying to do some cost sharing. So I think definitely it's an opportunity for you guys to open your mind and jump on board with some Medicare Advantage because of that cost sharing and how the trend is going.
Well, I thought too that Medicare Advantage didn't have as many benefits before, and now they're allowed to have more.
Absolutely.
Benefits too.
Yes, and each year for the past several years, CMS and Medicare have given more and more money into Medicare Advantage. So you're seeing the benefits grow greater and greater. And I say 5%, but what I've heard, and I honestly have not actually seen this in writing, but what I always say is Humana or a Medicare Advantage company can't profit more than 5%. So the government has set this standard, so anything above that 5% limit, they have to put back into their benefits. Whereas for Medicare supplements, they can't standardize those financial opportunities or growth for an insurance company on that end of it. So it's kind of something that the government is wanting to get their hand in to kind of control. So that's, I think, why the trend's also headed that way.
Okay.
All right, so if that hasn't convinced you enough, here are many more reasons to sell Medicare Advantage. In the United States, 10,000 people turn 65 every day. This fact presents an unprecedented opportunity for new business. So if you're not selling Medicare Advantage plans again, you're likely to lose clients, and you're also likely to be leaving money on the table. So guys, let us just tell you, if you're wanting to increase your bottom line, start selling Medicare Advantage. Roughly a third of all Medicare enrollees are in an MA plan. And some Wall Street different groups estimate that MA will be the majority option by 2021.
Hold on, I'm having some questions about not being able to see the slides.
Did you share the screen?
I did.
Stuck on beginner's guide.
Yes. Can you guys see this?
It says it's showing main screen. Oh, there you go. Now I
Is it
can.
there?
Okay.
You can see it?
Oh,
I
it's
see
Kelly.
it in the
Yeah, she
background.
can see it now.
Okay. So sorry about that.
So you want to go back up and just show
Yes.
them? Thank you, Kelly. I appreciate you letting us know. Sorry, we're just now seeing this.
So there's, I think somebody wanted to re-see the map.
Uh-huh.
So here's the map.
Go back up.
This is the premium information. And then the graph.
So again, 80% is Medicare Advantage plans that you guys can actually sell.
Sorry about that once again. Thank you so much for letting us know that. All right.
All right. You want to go back to the, the reasons to sell, just in case you guys want to take a peek at this so you can see even more reasons to sell. You know, we've heard the past 2 years Medicare Advantage plans actually tipped Medicare supplement plans. So again, if you've been primarily a Medicare supplement agent, this is the way that the trend's going. So we hope to be able to
at least add this in your briefcase. We're not trying to get you to switch from selling Medicare supplements. If you sell Medicare supplements, that's absolutely what we want you to continue to do. But we want you to be able to add this in your briefcase, in your portfolio, because really what you're doing is walking away, leaving money on the table. If you go into a home and either A, they cannot afford a Medicare supplement, or B, it's just not really what they want, and you're walking out the door rather than selling that Medicare Advantage or prescription drug plan, then you're leaving money on the table.
Absolutely. So. No, I just noticed we didn't plan this.
Oh, yeah.
We're stripes. If you're not on Facebook Live, we're both wearing stripes today. Okay, so Medicare Advantage Agent. Adrienne has created a wonderful handout, as always. It's a worksheet, a checklist, however you want to reference it, on becoming ready to sell, how you become a Medicare Advantage agent. So page 1 is literally, how do I become a Medicare Advantage agent?
And they can download it.
So you can download that in your handout section. The first, which you'll see the first page of the handout on the next slide, but it is titled Becoming a Medicare Advantage Agent. So the very beginning are the steps that we're going to go through. So, Jennifer, if you want to read the steps, and I'll chime in if there's anything.
So step 1, and once again, we're really at the basics here, is check with your state Department of Insurance to determine the requirements to actually become a licensed agent. So if you're on this call, which I would imagine you wouldn't be on this call if you weren't a licensed agent, but if you're trying to get downlines or start an agency where you're building that, it really is really simple. And these are the steps that you could go through to actually get downlines and start an agency. So step 1, obtain your insurance license. Take your resident licensing exam for your health insurance. Get the license. I would recommend life and health, not just health. But step 3, apply and obtain non-resident license for any states besides your homes. And I think that's really big too, Kristin. I said, because more and more people are selling insurance over the phone. And I think some of the Medicare Advantage companies are actually trending to this too, where there is electronic scope of appointments and things like that. So, you know, don't put yourself in a box that you can only sell to people that live in your state. So,
well, and bordering states. So, you know, in Memphis, if I live in Arkansas, of course I'm going to want to get a non-resident in the state of Tennessee. So, you know, make sure if you're on any bordering city or you're close to one of those states that Medicare Advantage is really good and you cross over and want to do any type of seminars over there. I mean, there's a lot of opportunities with just obtaining a non-resident.
And the last step, of course, would be to contact elder care, get your contracts, and certify with the carriers that offer Medicare Advantage plans. take your certifications. Those certifications are annual.
Mhm.
So, and we truly send lots of information out to let you guys know when the time has come, and it does seem it is getting earlier and earlier every year that these companies are opening their certifications.
But and I think this is where a lot of agents probably want to jump ship, because it is an annual commitment. The AHIP is a timed exam that can be very taxing, and it does cost. If you go to ahipmedicaretraining.com, it's it's $175.
$175.
Yeah. So, but there's a lot of ins and outs that we'll be happy to discuss with you on how to go and download material, where there may be discounts or reimbursements or stuff like that to help with the cost. But the certifications, guys, each carrier has the majority of the material that you can download. And so you're not stuck with this heavy burden of taking this exam and not knowing the information. Most of them want you to pass. So you're going to be able to have resources that you can use as like an open book. And so we walk you through all that. If it's your first time, it can seem overwhelming, but that's what we're here for.
Yes, yes, yes.
Okay, so this is page 1 of the worksheet. And I think it's just really good because it helps you as an agent to actually go through and to just write it all down, have it all on paper, and be able to look at it black and white. And even page 2 and page 3 are great for each carrier, so we'll get into that a little bit more. But for page 1, it's kind of what Jennifer covered, just the basics. When did you get your license, your exam date? Are there different carriers out there who offer discounts? Is there a carrier in your area that maybe you do not want to sell with? Because there are carriers out there locally who have maybe bad reputations, or doctor's offices don't want to take X and X company. That's something that you may want to put down, and then that way when you call us to discuss things, you already know, this is a carrier I really don't want to take. It doesn't matter.
And so that first bullet point says how many contracts to begin with, and that's really a personal preference. If we are guiding you, we are going to not just throw contracts out at you. We're going to actually do our homework and pull up what's in your area. It'd be silly for us to contract you with a carrier, even if they're in your state, but they're not in your county, because Medicare Advantage is based by county. It is a little different, and so we can help guide you through that. I would say always having at least the top 2, both on the MA side and the Medicare, prescription drugs. And the other thing with that is you really don't know how great a carrier is going to be until the new stuff comes out. And so it's year to year. So we can help you with that. Yeah.
And another thing on top of that, don't feel like you have to jump in and get that's okay, Misty, we forgive you. Don't feel like you have to contract with every carrier. We don't want you to contract with every carrier and to feel overwhelmed. Take it slow. Start out slow. Get, like Jennifer said, 1 or 2, and know those 1 or 2, and the next year add another one. Or once AEP starts, if you realize that there may be a PDP that you're going to sell over and over, you may want to pick up that extra company.
Yes. So now you're contracted and you're ready to sell.
Yes.
Signed, get your feet on the ground.
Well, you want to become ready to sell. So now you know what carriers you're contracted.
Yes.
How do you become ready to sell?
All right.
Let me tell you this. Ready to sell is a lingo for Medicare Advantage.
Yes.
You're going to want to be ready to sell, because if you're not and you write an application, you're not going to get paid commissions. So Adrian said, well, how would I write an app if I'm not ready to sell? Well, say here in the office, Jennifer has some apps sitting around. I think I've completed all my certifications. So I go write, a Medicare Advantage app and I submit it. Well, I didn't actually do a market training, or I never logged back into SilverScript to print off the certificate, or whatever it may be. I don't get paid for that policy. Typically, they're still going to issue it. But if you go through everything and you miss one step and aren't ready to sell, submit an app, you're not going to get paid. So make sure that you're ready to sell.
Yes, absolutely.
I really thought that was an elder care lingo. When I
Yeah.
started getting ready to sell, I thought it was an elder care.
No, no.
Insane.
Carriers deem you ready to sell. Elder care does not. I wish we could. Okay, so page 2 of your worksheet is actually becoming ready to sell. So this is what I say for each carrier you're going to have. If you're brand new, print one of these off for each carrier because you're going to want to know, how do I submit an application? You can actually pencil it in. How do you order supplies? Call elder care. No, really, that's something that can be overwhelming. Just give us a call. Let us help you out with that. Networking. Networks are huge. So if you're sitting in front of Miss Jones uses Dr. Boyd, and Dr. Boyd is not in, say, Humana's network, you're not going to convince Miss Jones to take Humana. She's going to want to stick with her doctor. So you're going to have to verify every single time that their doctors are networked, and not just PCPs, but specialists. She's been seeing the same, ophthalmologist. Make sure they're in network.
And hospitals.
That's true.
What about pharmacy?
That comes with the prescription drug side of it. But yes, so when you're actually writing an app for a prescription drug plan, one of the questions you're going to ask is, which pharmacy do you use?
So what if isn't there a, what do you call it, MAPD? Like a Medicare Advantage with a prescription drug?
So
Do they have pharmacy networks?
Yes. So what I always recommend, no matter what, before you sell a MAPD or a PDP, you go to Medicare.gov. We'll need to do a small little webinar where people can see, but it is going to be your guide we have a video. It's like 15 minutes long because there's all kinds of really neat tricks on there. But it shows you, once you input their drugs, annually what the cheapest plan is going to be. So from there, you break down, okay, so plan A pops up the cheapest annually with the pharmacy that, either you go to or mail order. And from there, make sure their doctors are in network. So there's a process that we'd love to teach you so you know for sure that you're giving Miss Jones, or you're showing Miss Jones what the plans are available in her area, and she's choosing which one she would like to use.
Right. So marketing, did you want to go over any of the marketing?
Sure. So, yes. So if you're going to be marketing for AEP, what pieces do you want to use? Make sure they're CMS compliant. Call us before you send anything out, please. Are you wanting to do events during AEP, or are you wanting to do educational seminars? There's all kinds of opportunities to get you in front of whatever the population you're wanting to market to, turning 65.
But you can't, you don't just market for AEP though, right?
No.
You can market.
Yeah. So turning 65 all year around, I suggest, this is kind of an off subject, but, turning 65 Medicare 101 seminars where you're out there in the community and you're, building relationships with clients, you're, just building those relationships with your community, and then you can pull out your becoming ready to sell and summary. Anyway, okay. Moving on. So I wanted you guys to see, so when you take a plan and you're looking at it and you say, I don't really know, what a client would want to know or what a client would want to see. So if you contract, this is Allwell. I just pulled the summary benefits that I knew was the most concise and easiest for you guys to see, just as an example. So this is Allwell summary benefits for 2019 in Garland County, which is where we're located. The plan premium, of course, the client's going to want to know, how much is this plan? Well, it's $0. There's $0 deductibles for medical services. There's a $250 deductible for Part D. So all of these things you're going to want to go over with your client before you enroll them. The max out of pocket is very important. So as I was talking about earlier, for original Medicare, there's no cap. Well, with Medicare Advantage, Ms. Jones, if you're out of pocket, if you pay out of your pocket $5,900, the plan pays 100% after that. So it's a little assurance for them to know there's a cap that I'm going to pay annually. And that's not saying they're going to pay that annually. That's worst case scenario. So inpatient hospital coverage, most plans are going to offer days 1 through 5, X copay per day, days 1 through 6, $310 per day, and then beyond that, they don't have to pay a penny. Outpatient hospital, doctor visits, everybody's going to want to know my PCP copay. It's $0. Specialist is $40. Preventative care, of course, is $0. Emergency, but these are what you want to go over with them. Hearing, dental, vision, over-the-counter benefits, all of that is something extra and above original Medicare. So you want to let them know this plan offers that. So for hearing, you can see there's hearing aids, 2 hearing aids every year. That's huge.
Mm-hmm.
Dental, there's a $40 copay per visit, but there's a maximum allowance of $1,000 per calendar year. So if they are going and they need to get, dentures, a crown, anything, they have $1,000 per year. So again, original Medicare, do they offer dental services?
No.
They don't. So does Medicare supplement?
No.
So see, you see some of the benefits right here.
That's the only difference between the summary of benefits between a Medicare Advantage and a Medicare supplement is that they have.
There's all these,
no, those are huge differences between the benefits between a Medicare supplement and a Medicare Advantage plan. Medicare supplements don't have a max out of pocket. If Medicare pays 1 penny towards this claim, then your supplement's going to come in and pick it up at 100%.
So you pay your monthly premium, which may be $100+, but you don't have to pay a penny for anything else.
Right.
Medically.
There's a big difference between the summary benefits
And your Medicare supplement.
Yeah.
What it covers and things like that. Like Medicare Advantage, like she said, hospitalization, they have to pay $310 per day, days 1 through 5 or whatever. Medicare supplement, you wouldn't if you had a Plan F or Plan G.
So like their summary benefits is a lot smaller on the Medicare supplement?
No, they're more robust. You're not out of your pocket as much that you are with Medicare Advantage if you're calculating in
But it's just
the
A
premium.
and B.
Right.
Period. So there's no dental, there's no vision, there's no extra added value services that are extra added value, which I wanted in there so bad because that's what makes Medicare Advantage stand out.
Right. Is the extra.
Extra added
Yes.
value services. So, okay. So you can see ambulance, they have co-pays, and then there's drug plans built in. So again, on Medicare.gov, you'll see based on the drugs that they take, what plans co-pays are going to be the cheapest annually for them. So it's huge to go to Medicare.gov first before you enroll anybody in anything because Medicare knows best. So this is just an example again, 0 copay at a retail or a standard retail pharmacy, which Medicare tells you, which Medicare.gov tells you those.
So we have quite a few people watching on Facebook Live. Anybody have any questions so far?
0 stripe.
What about on?
0 stripe. I'm playing.
No questions so far?
Okay. So again, this is just some more added covered benefits. Over-the-counter benefits, it's huge. They get $100 per quarter for, over-the-counter items. So ibuprofen, Band-Aids, anything that you can think of that you would buy over the counter, they get a catalog with the carrier and you get $100 per quarter, so $400 a year. And some of these, especially when you get into chronic conditions or duals, those amounts are very high. So
let me go back and just specify, because if you're just learning Medicare Advantage, these benefits that we're going over are for a particular carrier.
Oh, yes.
It doesn't mean that every Medicare Advantage that you sell is going to have these exact benefits. And some might not offer dental and hearing.
Mm-hmm.
So those are the extra things that you're looking at when you're choosing a Medicare Advantage plan for your client. So I just wanted to put that out there a little bit because I don't want you guys thinking it's with everyone.
Or maybe you're choosing a plan that you want to represent to be able to show your client.
Right.
Yeah. So thank you for pointing that out because it is going to vary drastically sometimes between carriers, and that's what you need to know before you really contract with a carrier. You don't want to pick up a Medicare Advantage plan that doesn't have benefits that are going to benefit your clients.
Yes.
That's what the worksheet's good for.
That's what the worksheet's good for, and that's why that was right here. So, you know, what, I think it's on the
Other one?
right, it's on this one. Oh, yeah. So it's on page 3, checklist during your appointments with your clients, submitting an application. So you will see page 3 here. This is what you're going to want to know, and this is the homework you're going to want to do with your clients. Yes, our webinars are always available after listening.
Mm-hmm.
They're on our
Facebook
group, Facebook page, and YouTube.
Okay.
Yes. And we do send an email out.
And LinkedIn
And if you want a personal webinar where you just want to be handheld through all this, give us a call.
Yeah.
We'll do it all day long. So this is what I would really recommend for you guys. Do not submit an application if you're new, if you haven't looked at this, because it really does cover the majority of steps. So number 1, what election period does your client qualify for? And this is getting very specific about submitting an application. So you've contracted, you've certified, you've been deemed ready to sell. Now what do I do? So you have your supplies, whether that be paper applications, you have the e-app, whatever it is, and now you're sitting down and you're getting ready to sell. So you want to make sure that your client has a election period that's valid to submit an application, period. It's not like Medicare supplements where you can take an app year-round. They may have to go through underwriting. Medicare Advantage has election periods that a client has to qualify for in order to submit the application. So IEP, there's a lot of abbreviations here. We have a handout that is one of the best handouts because it's very, very descriptive. It's very long. It's like 36 pages, but that's my election period Bible because I have it printed out. There's Medicare Advantage, there's PDP sections, and so if there's an SEP, which is typically where you want to know if they qualify, that's where you go to make sure that your client has an election.
And SEP is special election period.
So we'll get into that. It's just
Yes.
there's a lot with this one question, and we can go into that further maybe sometime, but yeah. So IEP is, we'll just flip over here real fast. This is kind of a highlight of those election periods. So IEP or ICEP, initial election period or initial coverage period. So you can see that they will have 3 months prior, the month of, 3 months after they become eligible for Medicare. They're turning 65. And ICEP is typically when their A and B parts differ. So say they're 65, they take out Part A, they work a couple more years, and they stay on Part B, you'll have an ICEP. Way too many abbreviations.
Yeah.
So if they're newly eligible for Medicare, that's an enrollment. During OEP, which is
now
back for 2019, from January 1st through March 31st, they can use, or you can use an OEP election. So this is only going to apply if they are on a Medicare Advantage plan currently. So if they want to switch Medicare Advantage plans, if they want to go back to, if they're on a Medicare Advantage plan, they want to switch. If they're on a Medicare Advantage plan and they want to go back to original Medicare and pick up a PDP plan, there's different options during this time period. For an SEP, which is a special election period, there are different qualifying circumstances that a member has to where they can enroll through into a new Medicare Advantage plan. So typically, I'm watching Adrian's face because I can see if she's in question, you guys might be in question. But typically, if they're not newly eligible for a Medicare Advantage plan, so they're not newly eligible for Medicare, and they are not changing their plan during AEP, which is October 15th through December 7th, which generates a lot of business, then they're going to have to qualify for an SEP. because that's typically what we've considered block-in for the remaining part of a year. So again, like Jennifer had mentioned, Medicare Advantage runs each calendar year. So each year, at the very end of the year, the clients have to decide what plan they want for the following year, which is the changes that are made during AEP.
So many.
Oh my goodness. That was a little more wordy and too much. So we can talk about that. You guys, there's a lot to learn. And a lot of this is taught to you again during certification. So, but back to our worksheet. So the first question can be a little much in that one question, but you need to know what is their qualification for this application. So do they qualify for any low-income subsidy? Are they Medicare and Medicaid, which is a DSMP, a dual special needs plan, or a CSMP is a chronic conditions. So some areas will have a chronic condition special needs plan where they have diabetes. They can enroll into a plan. We're going to talk about that next week, so I'm just going to move right on. The medications, like we talked about earlier, Medicare.gov. There's no underwriting with Medicare Advantage Fund. I don't know if you knew that, Jennifer, but, so if you have clients that are difficult, have a lot of health issues, the only question that they have to answer to proceed is, do you have end-stage renal disease? Mm-hmm. If they answer yes, do not pass go. No. It's a bad idea because they will not, that application will not be issued. So then you want to go into how do you explain the differences in the plan. So how do you went over that summary of benefits? Do they understand you may not have a monthly premium, but you have copays? So making sure that they understand the difference in I have a premium that I pay every month, but I don't have copays with the Medicare supplement. They may not have a premium, but they have copays every time they go to the doctor. So going over that, making sure they understand it. Has your client signed and filled out all the necessary paperwork? Every line on an application needs to be filled out, period. There's no ifs, ands, or buts about that. I always recommend sending applications directly to the carrier, just so, because applications need to be submitted to the carrier within 24 hours. Yeah. So, but yes, it's huge. So some carriers will allow a 48-hour period. I don't mess with that because I don't want agents to think, well, I can hold this app for 24 hours. I can fill it out and then I can get it to them, the next day. My rule is have every application submitted to the carrier that night. So you want to make sure it's complete. Well, if you're new, you may be like, I want to make sure that my app is complete. So call us, say, hey, I'm going to fax you this app. Will you look over it? And then we'll send it to the carrier for you within that 24-hour period. Just make sure you call us and let us know, I want you to look over this. That way we're watching for it. And we can go over the app with you just in case you missed anything.
Yeah, and then once we get you where you are confident in submitting those apps, then we go back to our recommendation of submitting those directly to the carrier. Yes. Because there's just less hands, and when you are in such a time crunch and there are certain guidelines, we don't want, in cyberspace, as we call it, we don't want an application to not get submitted within that time frame.
Yes. So. And with that being said, Adrienne has a bad question.
So why would an agent wait to submit an application? Can they not submit it in the house?
If you're in a rural area where you don't have, a fax available and you're traveled throughout the day, then that would be the reason they can't submit it in the house. Now you could, if you were doing an online, on some of those, you can actually submit it in the house. We can go into more details. There's some where you can actually sign them up for the VBE and things like that, and we can hit that in our next webinar. So there's a whole bunch of different things that we can teach you guys. But for the most part, if you're in a rural area or something like that, and you're not doing an e-app, you have to get somewhere that you can actually fax that app.
Yeah. Just fax it within 24 hours, and please save your fax confirmation. So if for some reason the carrier doesn't get your app, if you do not have a fax confirmation saying that you really did fax it, they're not going to honor you saying, well, I faxed it to you, you should have it. if you have a fax confirmation, they're going to take your word on that. Like Jennifer said, I recommend using e-apps too, because it's not going to allow you to move forward if everything isn't complete. So it's just a safety net. So like I just said, you want to, moving back to the worksheet, did you make sure the application was received? So along this same line, I recommend within 5 business days, absolutely, you call to make sure, hey, WellCare, WellCare is not a good example. Hey, United Healthcare, I just wanted to make sure that you received my fax on such and such application. And they're going to ask you those specific, what's the client's name, date of birth. So have that app in front of you when you call to check on the status. If they didn't receive it, great thing is you can refax it with your fax confirmation. But then with that, you want to call let me go back. So did you explain or leave behind information on what happens next? So before you leave that house, guys, make sure that you let your client know, here's some material I'm going to leave behind with you. You should receive your ID card in X amount of days. If you have a problem, pick up the phone and call me. Don't call Humana. That's how complaints are filed. If they have a problem, you need to have your name on your business card or written on a Post-it, wherever you can. Some companies, you should write it on certain pieces of paper that's carrier specific, but make sure that they call you and not the carrier.
So one thing I didn't see in here when you're getting ready to sell it and you've got this app and you've determined all this stuff, I've heard this term called scope of appointment. So I didn't see scope of appointment in here anywhere.
Yeah.
So I think that would be the first thing that you have to do is to get that scope of appointment. And now there is electronic scopes. And so if you don't know what we're talking about, it's basically with your client is signing what they call a scope of appointment, giving you permission to talk about Medicare Advantage. There used to be the 48-hour cool down period. So if you heard that in the past and you think, oh my gosh, you used to have to actually go in a home. You've talked to Ms. Jones. She says, yes, I want you to talk about Medicare Advantage with me. You'd have to actually get this piece of paper signed that was a scope of appointment, and you'd have to say, okay, Ms. Jones, I can't come back for 48 hours and actually write you this application. Well, luckily, they took that away. Was it last year? Last year, they took that 48-hour cool-down period away, but you still have to get a scope. Some companies signed. Some companies don't require you to submit the scope. But our rule of thumb is when in doubt, get the scope it out. And so we can get more in details about that, but I just wanted to make sure everybody knows you still have to get a scope of appointment before you can write that out.
That should be number one.
Number one.
And again, this is kind of where, I do this every day, and so I don't even, that's why Adrian's here and Jennifer's here, because I didn't even catch that. So, very, very important. Yeah, we will update a revised worksheet, which I should go ahead and say, we will email you the revised worksheet, and if you complete the worksheet to the page one of the worksheet.
We're going to email you after this webinar, all the worksheets and things like that. We might have some fun stuff that we email you as well.
Okay.
So general follow-up. Are we there?
We're there.
So that was the end of the worksheet.
So that's the end of the worksheet. And again, maybe if you're watching this webinar, you might say, I see why I didn't want to sell Medicare Advantage. It seems overwhelming when you talk about it if you're brand new and the lingo and the terms, but truly that's what we're here for. We want you guys to call us and utilize us and help you break it down very slowly on each of the steps.
And it is really simple when you come to it and get it all lined out. So don't let us overwhelm you. Don't let people tell you, oh, you don't want to do Medicare Advantage, you're going to get, you're going to get a complaint, and then they're going to pull your light. It's not like that.
No, we help you on the compliance side.
Yes.
Any questions that you have, I mean, if you want to market compliantly, we can tell you what you can and can't do. We have a compliance team that will look over material.
Yes.
I mean, it's very black and white, and so once you learn those rules, it's pretty easy. What I do want to chime in here, though, is if you're not selling Medicare Advantage, right now is a really good time to get into it, just maybe one carrier, maybe two. That way you can kind of like learn some of the lingo, not be overwhelmed when it comes AEP and people find out that you sell Medicare Advantage and everybody's calling you wanting to change their plan.
And when is AEP, Kristin?
Oh, AEP is the annual enrollment period, and that starts October 15th through December 7th.
Yes.
It is a great time of the year. It's my favorite time of the year. So after the sale, so after everything that we've talked about, you, again, want to call the carrier, make sure that they've received it, make sure, CMS has approved the app. Go ahead and handwrite a thank you card. This goes into client retention. So you've certified, which is a lot. You've chosen what companies you've certified. You go through all this. You want to maintain these clients. So write them a letter, thank you card. Call them. Say, hey, have you received your ID cards? Just want to make sure, that you received them.
Would you call them and let them know that the app has been approved or accepted?
Yes. And I'm a licensed agent, so that's what I do as well. Yes, it's been approved. I've checked on it. It's been issued, and then you should be watching for those ID cards in the mail. Once you receive them, if you want to give me a call to let me know you've received them, or I will call and follow up with you. So it's a preference, But it gives you the opportunity to stay in contact and build that relationship even more with your client because, every contact you have with them
just makes you a nice person, I think.
Yeah.
To let them know.
Yes.
So, and during one of those calls, after their plan is active, when you reach back out to them, hey, have you had any problems, filling your prescriptions or going to see your doctor? Remind them of those benefits that are in that plan. So a lot of carriers have wellness appointments, like benefits. So wellness appointment, what was the word? Like
encouragement to go
and get a wellness. Yeah. So they can go ahead and make sure that if their client has maybe diabetes that they didn't know about, they can start taking care of them better. So a lot of carriers will incentivize the clients, that's the word I was looking for, with maybe like $100 Visa gift card. So go and get your annual checkup. You'll get a $100 Visa gift card in the mail. And that just helps the plan truly take care of them, which is what they're wanting to do.
Yeah, they want to make sure that the client is on top of their health and making sure. And if they can get hold of that early, like you said, with the diabetes and things like that, they even have, like, some companies have diabetes supply stuff that they will send or things, even some of them can have nurses that will come out. I mean, that is, to me, what the extra value benefit to a Medicare Advantage plan is, because on the Medicare supplement side, they're not doing that.
They're not managing that care.
That's
kind of where the term comes from.
Right.
Yes. Remind them about their over-the-counter benefit. Make sure they've received their catalog so they can use that, for example, $100 per quarter. Plan check-in calls for the year. So definitely 30, 60, 90 is a good rule of thumb. Make sure that your client knows if they're having problems, call you. But also be calling them to build that relationship for opportunities for referrals and cross-sells and all those other things that come with one sell. And
I guess that is another good reason to sell Medicare Advantage.
Oh, cross-selling.
Able to cross-sell.
Oh, huge opportunities with cross-selling. We could continue on a whole nother hour if anybody wants to.
Yeah. But those are after that sale is made.
Yes.
I mean, just, you can't talk about Medicare Advantage and other products in that same appointment. So that's another little bit of it. But we certainly thank you guys so much for joining us today, and everybody that's on Facebook Live. We will continue this and continue to do some
Yes.
part 2s, part 3s.
Yeah, as you
learning.
can see, I mean, there's a lot to it, and it can sound overwhelming, but it's not once it's broken down on a simple level.
Because closer to AEP, we'll be more focused on, like, the stuff coming out.
Yes. Yeah.
So we're trying to get them ready.
And we take pride in actually making sure, you know, hey, if certifications are open, like we are on you guys about making sure you don't miss a step, so you're not left feeling like I don't even know what to do next.
Right.
So,
well, we will open the doors or the typing to
the keyboard.
The keyboard to questions. If you guys have any questions, we'll certainly answer those for you. And if we have any on Facebook Live, we'll answer those as well.
I'd love to see Kristin challenged. So
what?
if anyone has any questions about Medicare Advantage,
Missy, you're so
comment
sweet. Aw, we love you.
So join us next week. Do we have any questions on Facebook Live?
Mm-mm.
And let me just put a little shout out on our Facebook page. If you're not or have not liked our Facebook page, it's Elder Care Insurance Services. Go and give us a quick like, and then also ask to join our focus group. Our focus group is more like a little close-knit group that is our agents that we can sometimes share some stuff that we can't share to the public.
Like, is Marla on here?
I don't know.
So I'm going to use Marla as an example. So she had this great idea, and I'm like, we need to let other agents know about this, Marla. And Adrian said, you need to have Marla share it in the Elder Care Focus Group. So it's really a networking opportunity, and then it gives us the opportunity as well to be able to send encouragement or think of ideas and put those out there for you. But it's a great opportunity for you guys to help your fellow agents out as well.
Yeah. Well, I don't see any questions here. Any on Facebook? Okay. We just did an excellent job. There's no questions. All right.
All right, guys.
Thank you guys so much for joining us. We'll see you next time.